Hi everyone, I'm Dr. Taylor Wallace and I am super excited to introduce the Saqmolo Project, which is a large malnutrition intervention study that we're currently conducting in rural Guatemala. I'm going to begin by talking about the first 1,000 days and why this critical time point is so crucial for brain development in children. I'm then going to move into talking about eggs as a complementary food. Eggs contain all the nutrients that the American Academy of Pediatrics deem critical for brain development, and it's a really big opportunity to move the needle in the malnutrition space, in my opinion. The nutrient choline, my favorite nutrient, of course, heavily involved in brain development, the precursor to acetylcholine. We're going to get into that. And then finally discuss the design of the Saqmolo Project. It's always important to be transparent and declare perceived conflicts of interest. Funding for this study was provided through an unrestricted educational grant from the Egg Nutrition Center, which is a USDA checkoff program that supports the egg industry. We thank them for their gracious support of this study that enabled it to occur. I have been doing scientific consulting with the Egg Nutrition Center for quite some time. They're actually one of my favorite groups to work with per the egg is one of the richest sources of choline. The other conflicts of interest are listed on your screen. All my conflicts of interest can be found on my website, drtaylorwallace.com. Okay, so like I said, the first 1,000 days is really a critical time point where optimal diet quality during complementary feeding has an effect on growth and development, and long-term health has been well documented in the scientific literature. Now, timing is crucial for nutrition, and later compensation after the first 1,000 days will not be available to retrieve the lost brain function that the infant will experience if they're malnourished. So this critical time point from conception to 2 years is what we as scientists know as the first 1,000 days. And it is, again, very critical for establishing metabolic and behavior adaptations, including cognition. Maternal prenatal nutrition and the child's nutrition in the first 2 years of life are crucial factors in a child's neurodevelopment and lifelong mental health. Although all nutrients are necessary for brain development, the American Academy of Pediatrics consider the following key nutrients as critical for supporting neurodevelopment from conception until age 2 years. Those are zinc, iron, choline, folate, iodine, vitamin A, vitamin D, vitamin B6, vitamin B12, protein, and long-chain polyunsaturated fatty acids like DHA. Failure to provide key nutrients during this critical period of brain development may result in lifelong deficits in brain function despite subsequent nutrient repletion later in life. This includes major depressive disorders, emotional development, and many other aspects of both cognition and mood. I'll speculate and also add dietary fiber to the list due to its known beneficial effects on the microbiome and the gut brain connection that I talk a lot about. But these nutrients are the ones considered most critical for brain development. Now, why is an egg so important? Well, as you can see on the screen, the egg actually contains all of the nutrients that the American Academy of Pediatrics deem critical for brain development. What's also very unique about an egg, and we'll get into this in the coming slides, is the yolk is very concentrated in choline, which of course is involved in neuronal development and is the precursor, like I said, to acetylcholine. So an egg really is brain food in some regard. This table was created using the USDA nutrient databases. It shows the amount of each nutrient in a single whole egg, as well as the percent daily value for a child under 12 months or under a year. So as you can see, a single egg has 57.1% of the daily value for an infant's protein intake. 16% of vitamin A, 10% of vitamin D. So as you can see on the screen, an egg is a really excellent source of many of these nutrients that are key for brain health and more. Now we know that in the U.S., our data show that 90% of Americans and 92% of pregnant women fall short of their choline requirement, or what we know as their adequate intake. Eggs are a primary source of choline, and choline is obviously needed to produce the neurotransmitter acetylcholine. Now, why is choline so important? There are several genetic polymorphisms that influence your body's endogenous production of choline. And about 44% of premenopausal women in the U.S. actually have these polymorphisms that increase their requirement for choline intake from food, so they don't produce as much endogenously during pregnancy. Usually during pregnancy, estrogen levels increase, and with that, endogenous production of choline also increases, right? Because the mother's body is nourishing the infant. Deficiency during pregnancy, we know, increases the risk of neural tube defects, and as we'll discuss in the coming slides, suboptimal choline intake can have some pretty harsh impacts on cognition in the infant. So choline is not included in the World Health Organization's standard of care. So that's what's really interesting about an egg intervention. If you will notice in our study and other studies of malnutrition across the world, you'll see multiple micronutrient supplementation being a part of the intervention. Choline is not included in that standard of care. So there's not a lot of research out there in malnourished populations pertaining to choline. This is data from Cornell University in healthy infants in the U.S. Higher maternal intake of choline during the third trimester was shown to improve infant processing speed. So the DRI, the adequate intake for choline in pregnant women, is 450 milligrams per day. As you can see on the screen, this intervention was about the adequate intake and then twice the amount of the current adequate intake, and you saw enhanced cognitive effects in the infants at 9 months. And a follow-up to this study, children whose mothers consume the higher dose of choline per day during the third trimester, those children perform significantly better on color location memory at age 7. So this suggests lasting effects that extend into the school age years. So choline is an essential nutrient. At the same time, very neat research, mostly in animals, show that choline can really control cortisol stimulating genes and control cortisol stimulating hormones. Lower cortisol levels in the baby eases its response to stress. That also equates to increased learning, memory, and attention in rodent studies, and now we're also showing this in the previous study that I just showed on your screen as well in humans. Okay, now on to the good stuff. The Saqmolo Project, and Saqmolo stands for egg in the Mayan language of Cachiquel. This is an individually randomized, partially blinded, controlled comparative effectiveness study designed to evaluate the influence of adding delivery of a single whole egg per day to the local standard of nutrition care. So the treatment group will get the 1 egg plus the local standard of nutrition care, and the control group will just receive the local standard of nutrition care. The intervention duration is 6 months, and we're going to monitor child development, growth, and diet quality measures in rural indigenous Mayan infants aged 6 to 9 months at baseline. We are beginning the enrollment of 1,200 of these 6 to 9 month old infants, so we're super excited about this opportunity. So why Guatemala? Why this population? Guatemala is home to some of the poorest communities in the Western Hemisphere. Children suffer the highest rate of chronic malnutrition and stunting in the entire world, and in fact, some of these infants in areas that we're studying, stunting can get up to 70% in these populations. A woman in Guatemala is 10 times more likely than a woman in the United States to die during childbirth. Now, the Saqmolo Project is being executed in 2 departments in central Guatemala. Stunting, like I said, is about 70% in some of these regions per growth anthropometric data. The majority of the indigenous population in these areas live on less than $2 a day. And of course, there's huge inequalities in access to health care and nutrition services. And there's also proliferation of non-traditional agricultural exports and commodities that have contributed to this malnutrition. And you'll actually see some of these infants are stunted, but they're also overweight because of sugary products and shelf-stable items that have actually gotten into these communities in the past few decades. So obesity is actually an issue along with type 2 diabetes. So this basically illustrates the design of the study. Like I said, we're going to recruit 1,200 infants, 600 for the intervention and 600 for the control group. Now this is a parallel study. We anticipate a 20% attrition rate based on previous studies conducted in this region. This provides 480 infants for each of the 2 treatments, the egg and the control. With an alpha of 0.05 and 80% power, we should be able to detect differences for the change from baseline to the end of the study in both primary and secondary outcomes. So the treatment, again, is a single egg versus a single egg plus the local standard of nutrition care. And you can see to the right of your screen some of the field staff taking what's called head circumference, which is a measure of cognitive ability as well. Here you'll see to the right of your screen how we weigh the infants. The local standard of nutrition care includes growth monitoring, medical care, deworming medication, multiple micronutrient powders for point-of-use fortification, and individualized complementary and responsive feeding education for the mothers or caregivers. You can see the micronutrient powders for point-of-use fortification include vitamin A, most of the B vitamins, C, D, E, potassium, iron, zinc, copper, and selenium. Notice again that this is absent of choline, which is very important to this study. We are so thrilled to partner with a great foundation called the Maya Health Alliance. This organization seeks to unlock healthcare for those who need it the most in the area. It uses 4 strategies for community-driven healthcare, building trust, and restoring confidence in the power of medicine to change lives. And so they've been working in this area for over a decade, and we're really excited to have them as our lead partner in executing this study locally. Our inclusion criteria is as follows. Infants must be 6 to 9 months of age at baseline. At least one caregiver should be willing to provide oral informed consent and participate in study activities. They must plan to be in the area for at least 18 months, and we're only enrolling singleton births. Exclusion criteria. Infants with moderate to severe acute malnutrition are of course going to be treated separately and won't be enrolled into the study. Infants with severe anemia, same thing, and we'll adjust for altitude as necessary per the WHO guidelines. Infants with chronic medical conditions such as congenital heart disease will be excluded. Infants whose caregivers or have cognitive or other impairments that prevent them from being able to either provide the informed consent or to provide the information for the developmental assays that we'll need. Infants with a known egg allergy, right? Number one priority is safety. Infants with moderate to severe atopic dermatitis, another indication that they could have an allergic reaction. Infants with a history of anaphylaxis or severe allergic reaction to any substance, and then concurrent participation in any other clinical trial in the area. Our primary outcome measures will be differences in child global development scores, assessed using the Guide for Monitoring Child Development and the Caregiver Reported Child Development Instruments, known as the CREDI. And you can see the domains of the CREDI listed on your screen, those being motor, language, cognition, and social emotional. Secondary outcomes include changes in infant hemoglobin status, which is indicative of iron status, weight for age, length for age, weight for length, and head circumference, these anthropometric measures, and then diet quality using the WHO infant and young child feeding indicators. Those would be minimum dietary diversity, minimum meal frequency, and minimum acceptable diet. These are the primary investigators of the study, my co-investigators, who are all, absolutely brilliant individuals. And we actually published our protocol manuscript so you can read in detail about the Saqmolo project in the Journal of the Academy of Nutrition and Dietetics. The link has also been provided to you in several of these slides. You can click right to it and it'll go straight to PubMed. So that is all for today. I hope you enjoyed hearing about our study, and if you have any questions, do feel free to contact me. If you'd like to join my email list, you can text food to 202-410-4202, or you can sign up on the website drtaylorwallace.com. Thanks so much and have a great rest of the day.